There is little in Tony Bertone's life that can match the joy of playing with his one-year-old daughter. But because of severe back problems, that joy was almost taken away.
I was having spasms in my lower back. They were so severe that it felt like somebody had a sledgehammer and they were just pounding on my back. They had to give me morphine to settle me down.
Despite surgery, the pain was relentless. It affected his work as an architect in every aspect of his life.
It's like a shadow. It's always there. You close your eyes, it's there. You wake up, it's there. It makes your stomach hurt. You're nauseous because of the pain.
Then a friend told Tony about a doctor with the DRX9000, and he began the treatments that would change everything.
Ready?
After about a week, I noticed that my symptoms were lessening. I was able to maybe get up out of bed a little bit easier, which was very, very difficult for me. After about 2 weeks, I was starting to do other things, maybe take a couple of steps without the cane. Anytime I run into anybody that has a problem, first thing I do is tell them to get on the DRX.
And 2 months later, Tony Bertone is completely pain-free.
I can do anything, and I can't express it enough. I'm 41 years old. I could do anything I could do 30 years ago. It's incredible. I feel like I've been given 20 years back or more. I can play golf. If I go to a picnic, I can play softball. I can run. I could do anything.
And most importantly, he can bend down and hug the little girl who greets him every night when he comes home.
It's quite amazing. It gives you a whole new outlook on life. You're thankful for the things that you have because you've lost something, and now you've got it back, and you appreciate it that much more.
Ginger Jarvis is an active businesswoman and an active wife and mother. But 3 months ago, a herniated disc almost took all that away.
The pain that I had was a shooting pain down my right leg, and it inhibited me from walking. It made my legs very stiff. It was very uncomfortable to sleep, to sit, stand, do anything for extended periods of time.
After visiting her doctor, she thought she had only 2 options: pain medication or surgery.
We were going to go through the shots, we were going to go through the medicine, and then in 3 weeks period of time, a surgeon was going to be recommended to me. That was very scary, very scary. And at that point in time, I came home and started making additional phone calls to find out what other alternative options I had.
And that's when Ginger discovered the DRX9000 and began the treatments that would change her life.
It was the answer to my prayers to be able to find a non-surgical, non-invasive technique that could take me from pain on a scale of 1 to 10 of a 10 plus down to no pain and a normal lifestyle in 2.5 months is exciting. And in a very short period of time, it was very exciting to me. And it meant I had my life back.
And with her life back, she's getting back to golf and enjoying activities with her family and enjoying her very active job pain-free. And in her spare time, she's telling others about the DRX9000.
I would highly recommend the DRX to anyone that's thinking about surgery or in a painful situation where they have discomfort or herniation. It is great. It really changed my life.
After 14 years as a professional wakeboarder and 7 world championships, the impact of each jump on the back of Darren Shapiro started to take its toll.
This last year, I was riding on the tour, and I just became so frustrated because I was in pain all the time that I actually had to stop competing on the Pro Tour that year. And, you know, everything kind of stopped for me at that point. I knew I had to do something to get well.
So with his career in jeopardy, Darren went to see his doctor and was terrified by what he was told.
He said, well, we can do some surgery, we can put some screws in, some rods in, and that just sounded like the last thing I wanted to do.
It was then that Darren learned about the DRX9000, and after just 1 visit, he knew he'd found the answer.
When I started to use the DRX9000, it was perfectly in that area that I felt the release and the space come back between my vertebrae. And as soon as I stood up after my first visit, I felt like I was standing much straighter again. and my back was just so much happier to have that tension taken off of that area.
With the back pain gone, Darren was able to go back and finish the Pro Tour. And with the help of the DRX9000, he plans to keep competing for years to come.
Without the DRX, I wouldn't have been able to go back and continue competing. As I continue to train, I don't think if I wasn't using the DRX9000 that I would be training at all. It's just done really good things for my career. I plan on continuing to use it, as I continue training, which, makes me pretty happy because I'm looking forward to next year now.
As an occupational nurse, Valerie Vassell knows all about back pain, and she knew her personal situation was getting serious.
Gosh, I was in a lot of pain. Had difficulty sleeping at night, had pain radiating down my left leg. On a scale of 1 to 10, it probably was a 9.
Valerie also knew all about back surgery and the potential for major problems.
I don't think anybody wants surgery. You hear all the cons about surgery and the side effects and the surgeries that don't work and then the pain after the surgeries. So that's something definitely I was going to avoid.
So using her medical background and resources, she researched every back treatment she could find and concluded that spinal decompression through the DRX9000 was by far the most effective.
I looked up everything on the website. I saw how it was invented and who invented it. And yes, something this simple works. It's state of the art. It's technology at its best.
And after a series of treatments, everything she had read about the DRX9000 was confirmed.
After 20 treatments, I can tell you I'm pain-free. I can do all of the things I couldn't do before. Last night, I walked in this heavy, deep snow, no pain whatsoever. I don't have to take any medications whatsoever. I sleep a full night's sleep. I feel flexible. I'm feeling wonderful, and I totally believe in this product.
We've had some great results. We've had people that have gone on here, and just the leg pain that they were being treated for 3-4 months is gone. Just gone. They can sleep through the night. They can, do more things than they did before, and it's just really exciting to have that. And then we have to just be better at our in-office education.
This is an option that they have, and short of surgery, what does the patient actually have to lose? We explain to the patient it is non-surgical, it's non-invasive, it doesn't hurt. Dedicate a couple of treatments to our DRX machine to see how you respond. If you don't get better, we'll look for something else, but the vast majority of people have been getting better. And that is the advantage of trying it first to see if you're going to respond to it. If you do respond to the treatment, it'll keep you out of surgery. It'll keep you out of epidurals. It'll keep you out of long spinal needles. I mean, this is the way you should try. I can tell you, in answer to your question, if it was me or my family, and I have worked on my own family, with great results, by the way, that I would try it on me first before I did anything surgical. This is a nice alternative to surgery. And again, if it was my body, there was no other way that I would recommend than the non-surgical approach first.